We'll move on to the afternoon program. Okay. Then remind me after this to give you the link to put in your questions. Okay. So this lecture is not so heavy. I think you are very familiar with it on medical ethics. Okay. If anyone have any problem during the presentation, just let me know. Okay. All right. Just shout out what's your problem. Okay. So what we'll do today is just look at some of the basic principle of medical ethics. Okay. All right. Just go to the next slide. Okay, so what are ethics? Ethics are moral principle, what is good or bad, what is right and wrong, based on value system, and it is actually not universal. Sometimes it depends on subculture of the society, but the basic principle remains the same. Okay, so if you want to go into the definition, as a general definition, ethics refers to standard of behavior that tell us how human beings ought to act in many situations in which they find themselves as friends, parents, children, citizens, business people, teacher, professionals, and so on. Okay. Okay. So historically, do you know where medical ethics came from? Any idea? Anyone? I can't hear. Want to say something? Anyone? Any answer? Oh, you finished too early. All right. Anyone?
Greece, doctor.
Okay, Chris. Okay. Specifically from who?
Hippocrates, is it?
Yes, Hippocrates. Okay. All right. So as as your friend mentioned here, so medical ethics may be traced to guideline. Okay. So the main core actually came in, the base came in for the Hippocratic Oath, and over time people have after the wars, especially the extreme cruelty by the Nazis and also Japanese during the preoccupation of many countries during the World War II. The statement has been changed and refined. Okay, all right, and I'll come back to this slide because I think a lot of people have thought block if I said this Bain is who. Okay, I'll try to actually remind who is Bain. Okay, so if you see the Hippocratic oath, if I can just read out to you, okay, it's not very long. Okay, I swear by Apollo physician, by Asclepius, by Hygeia, by Pentecost, by the gods and goddesses, making them my witnesses, I care which I will carry out according to my ability and judgment, this ought and this indenture. Of course, when you read this ought during when you have graduated, they have changed a bit, modify a bit, okay? Especially remove the name of the gods and so on. To hold my teacher in this art equal to my own parents, to make him partner in my livelihood, and when he's need of money, to share mine with him, to consider his family as my own brother, to teach them this art. They want to learn it without fee or indenture. Okay, to impart precept, oral instruction, and all other instruction to my own sons, the sons of my teacher, and to indenture people who have taken the physician oaths, but to nobody else. So teachers are highly regarded, okay, during that times. Okay, I'm not sure nowadays how highly regarded are teachers. I still hope they are highly regarded, but they are the one that are willing to teach. Okay, all right. So I will use treatment to help the sick according to my ability and judgment, but never with a view to injury and wrongdoing. Okay, so in here also mentioned that you will do your best, but you will never uh, you will try to avoid any negligence or wrongdoing. Okay. Neither will I administer a poison to anyone when asked to do so, nor I will suggest a cause. Okay. So this is talking about euthanasia. Okay. Similarly, I will not give to a woman a pessary to cause abortion. So this is in regards to illegal abortion. But I will keep pure and holy both my life and my heart. I will not use knife, not even worthily or sufferer of stone, but will give place to them to such craftsmen therein. Okay. So this is managing your expertise within your competency. Okay. So cases that need the surgeon's input or other experts input, you should input. So uh, you should refer to that experts. Okay. In whatsoever houses I enter, I will enter to help the sick and will abstain for all intentional wrongdoing and harm. Okay, so don't hurt the person, okay, a patient, especially abusing the bodies of man or woman, okay, born or free, and whosoever I shall see and hear in the course of my profession as well as outside my profession, my intercourse with men, uh, if it be what should not publish abroad, I will never divulge all such thing to be wholly secret. Okay, so it's talking about the concept of confidentiality, very nicely written. Okay, now I will carry out this oath and break it not. May I gain forever reputation among all men for my life and my heart. Okay, if I break it and swear myself, may the opposite befall me. Okay, so this is very nicely written. Okay, all right. So I taken this from Wikipedia. Okay, the Hippocratic oath. Of course, when it's written was initially in Latin, then was or Greek, then was translated to English lah. Okay, by Mr. V.H.S. Jones. Okay. So if you can see in this, the what is interesting in this Hippocratic oath, they already put all the principles, and which later on the various experts came and actually, dissect it and actually put out the principle very nice. Okay, if we go back, uh, do you know Spain? Any idea?
No,
Anyone know
doctor.
who's?
Batman.
Yes.
And
Who is
there's
that?
this character from Batman.
Yes, yes, the legendary villain. He's as legendary as Thanos from the Avengers. Okay. So what happened was Bane actually in one scene in the movie from Batman, I think Dark Knight Returns or something, if I'm not mistaken. Rises. Dark Knight Rises. Okay. Uh, he was doing something with his co-villains in some underground tunnel. Then somebody came to him and Uh, one of the villain caught the commissioner of police, Mr. Gordon. Okay. And then the pain asked that person that actually caught this Commissioner Gordon, why are you here? Okay. All right. Okay. But that's all I want to take from that. So the question I'm asking all of us, okay, all of you, all and also me, why are we here? What is our business here? Is our business here to treat the patients? And are we doing justice to the patient? Or our purpose is different from that. If it's different, then we are in the wrong profession. Okay, all right. So remember the Bain statement. So you will forever remember why you are here. Okay. So in regards to that, a physician must recognize the responsibility to patient first and foremost, as well as to the society, other health professional, and finally to oneself. Okay. All right. So you must first, your main responsibility is to your patient. Second is to your society, then to your fellow health professional. Okay. And finally is yourself. Okay. These are not laws, but standard of conduct which define the essential honorable behavior for the physician. We must forever take care so that the honorable regards that is given to the medical is forever respected. If you don't take care, then the respect for the medical profession may deteriorate over time. Okay, so these are the four basic principles of medical ethics. Of course, they have subsection like in like confidentiality may be in under the autonomy and so on. Okay, and and then the others subsection maybe litigation and so on, maybe in the beneficial and non-beneficent principle. Okay, so what are the four basic principle of medical ethics? So okay, so what are the four basic principle of medical ethics? The first is autonomy, beneficence. Third is non-maleficence, and four is justice to all. Justice. Okay, let's go to each. We just put the next. Okay, so the first one is autonomy. So in autonomy, patient has the freedom of thought, intention, and action when making decision regarding their healthcare procedures and treatment. Okay, so remember, a patient that is mentally competent, okay, not also in able to give consent, okay, not in the case of semi-comatose or comatose, they can't give consent. Then the next of kin is the one that actually should give consent, okay. Remember just now, what they call Mr. Ranjan said about the health professional actually can proceed if the patient is comatose, okay. Any opinions regarding to that without consent? What do you think? Any one of you? Can give me your opinion? Can we proceed? Let's say for emergency situation, if there's no next of kin.
Um, Doctor,
Yes.
ideally we can't. Legally we can't actually. However, I think according to the guidelines, it states, but this is in the hospital setting. Usually there'll be two consultants signed and verified by a nurse or allied health, isn't it?
Yes, yes, you are right. Okay. So in cases of extreme emergency, where is the life and death, you can actually get two consultants, okay, to actually make the decision, okay, because consultants are regarded, as the top decision maker in the respective departments, okay. Maybe they need to get one, maybe it's, let's say, need an emergency cesarean section, or patient having severe bleeding, postpartum, and patient unable to give consent, okay, husband not around or any next of kin, then perhaps one anesthetist or hospital director or whoever, ONG specialist, they can come in and chip in and give the consent. Okay, all right. So yeah, okay. So
Dr.
for a
Naveen?
patient to make full, yes,
Yes, sorry again, but would we need to revise the emergency consent to an informed consent once the family members are available? Or is there
ye-
anything?
yes, you still, I guess it's still wise to do it, but maybe because if the consent already taken, you have already document in your case notes. I guess it's okay. You don't need to, as I said, you can't. As what Mr. Ranjan said, we can't backtrack or something. Okay. So the best course is actually document in your case notes, lah. So initially it was done, who gave the consent and whatever. Okay, then after that this was informed at the one in the presence of witness and all that they understand. You can make them sign, I think, in the case notes. Okay, but not, I think, if you say in that form, the informed consent, then will be a bit like not proper lah, I guess, because already we had done the procedure. Okay, so I think if we can follow that, then should be okay. That's why the case notes are kept 7 years for all department, but for ONG and PITS may be kept much longer. Okay, ONG can be up to 20 years. PITS is so similar. Okay, all right.
Excuse me, Dr. Naveen. Can I ask?
Yes.
Actually, this situation happened when I was in Kuantan Hospital at that time.
Okay. Okay. Okay.
I had this patient, MVA. I think he's about 10 years old at that time. They came to the emergency department.
Okay.
His was life threatening. The mother was present. But due to his condition, there were two consultants actually. They consented, but they could not proceed because the mother is there. When they counsel the mother keep insisting, tunggu suami saya datang dulu.
Okay.
So during
What
this,
injury the child had actually?
I can't remember. It was about 8 or 9 years back.
Is like a head
But I know
injury
it was
or
at the moment he was actually intubated and losing blood and all that because I just walked past by at that time. And this one was
okay,
I heard
okay,
there. Yeah. So this child, because he took his father's motor and somehow he got accident with a lorry.
oh,
Yeah.
okay,
Yeah. So the mother keep insisting tunggu suami saya datang, but the consultant have already signed, but
yes,
they still
yes.
couldn't proceed, right?
I think they can, especially for patients that can't make decision because they are minor. I think you still can, the two consultant, because the issue of life and death is the issue of life and death and need to do the thing the consultant can make. Okay, so the consultant can. In any case of curie, as mentioned, you can get a surrogate decision maker, who is either is the welfare police or whoever, okay,
I
that
see.
kind of thing to get the decision moving lah. Because you know if even the father come, we don't know what is the decision. Okay, the decision may not be he may support or not support. Okay, but what is important here, the patient is actually not able to give any consent, and the patient also is minor. Okay,
Mm.
right?
Yes.
The patient is also minor, so so that is a issue. So that's why later I will mention a bit about the minor, what we do with minor. You see a lot of cases, like even parents refuse intervention for neonatal jaundice and so on. Okay, so what we can do, or in the case of Jehovah Witness, where they refuse transfusion of blood and so on. So that's why the legal provisions is there lah, actually to help us. Okay, because we are the matter of life and death, we actually can act.
Thank you, sir.
Okay, all right, no problem. Okay. Uh, So for a patient to make a fully informed decision, okay, it's still your obligation to actually explain to them the risk and benefit of the procedure, okay? What is the likelihood of success, okay? Uh, and by then only they should actually choose what they want to do, okay? And which step they want to take. This may even include things like they want to, AOR, okay, against medical advice. So it's up to them because they are they are medically competent, okay, or mentally competent, and their age is 18 years and above. Anything less than 18, other people can make decision, especially the consultants, welfare, and so on. Okay. So always respect the autonomy of the patient, that the patient has a freedom to choose. Okay. So it's also to recognize and even prompt the autonomous action of the patient. Okay. So the autonomous person may freely choose loyalty or system or religion belief that may adversely affect him. Okay, that's just a minor point. Okay. Then when you take advice again, medical, advice, Disha again, medical advice, don't like just giving the form or he or her the form and just sign. Okay, you must advise also. And what you advise, okay? What may happen if they don't do this procedure, or they don't stay in the ward, or don't get admitted? You must explain so that later on, if the patient counter sue you, then you will have the evidence. Okay. So sometimes what happens is, in desiring to benefit the patient, the physician may strongly want to intervene, believing is a clear medical benefit. Okay. However, the physician has to duly respect the autonomous choice of the patient, so a duty to avoid harm and to provide a medical benefit. So that's why it's very important, the documentation. Documentation is very important. And now I will advise people, okay, I myself practicing whenever I examine female patients, especially involving the sensitive area, okay, then I will put the name of the chaperone present, okay, because after a few years you forgot what you put there, you know. Of course, after a few years, if you get sued or something, or a few weeks or something, then you don't know who is the chaperone, okay. So put the name of the chaperone. In the case of a female examining a male patient, if you really don't have a male chaperone, it's fine, get another female nurse, okay? But again, document in your medical notes, okay? So the medical notes is the one that will save you, okay? And make it sure it's slightly clean, that people can read. Not like just now you saw the plan deal, or I saw it, which is shocking. Nothing less than shocking. All right. And the physician should give greater priority to respect the patient autonomy, okay? So sometimes some doctors, I understand, they want to help the patient. Okay, they are stubborn, they got a paternalistic attitude, but doctor-centered kind of method of treating patients. So that is actually the problem. You want to do good and you want to stick with it, but you have to respect the autonomy of the patient. Patient free to choose. If after nicely explaining, doing tests, you decide, okay, you want to give this patient certain type of medication, but patient refuse, you can't force them, okay, because it's their right. Even you force them, you give them, they may not take it. Then what is the point? Okay, you spoil your relationship with the patient. Okay, you may get a complaint, and then patient also not take it. So you have to deal uh, very balanced, be very balanced in your decision making. Okay, and what the concept they call of shared decision making should be also promoted in this way. Okay. Now you'll see the case of a child. Okay. In the principle of avoiding harm of death and the principle of providing a medical benefit that can restore the child to health and life, this would give precedence over the autonomy. We can give precedence over the autonomy of the child parents, a surrogate decision maker in certain circumstances. So two consultants, or even involving other parties, the police or welfare and so on. Okay, but usually they want the consultants to take charge. The main reason is because the child is a minor. The child can't take a decision unless they are 18 years and above. That also, if they are mentally competent or they are in a state to give consent. Okay, of course, they are semi-comatose or comatose. There is no way you can get a consent. So you need to. So the law will protect you. Okay, as long as you document properly. Okay, then nobody can do anything against it. But also remember the negligence must be avoided lah. Don't leave the forceps what they call butterfly. What butterfly clip? I don't know what butterfly nut or what. I don't know this. Never heard of it. Okay. So these things all should not be left lah. Okay, inside. Otherwise you kena other section pula. Alright. Okay. So for autonomy, we go to beneficiaries. So the practitioner should act in the best interest of the patient. Okay, the procedure provided with the intent of doing good to the patient. Okay, so like in the example, okay, this patient already needs certain type of medication or procedure. So then you should advocate it, providing the benefit and the risk of the procedure or the medication. Okay, and also giving the patient some choices. Okay, so you need to be knowledgeable, have the skill. Okay, if you have the knowledge, skills, then only patient will believe you lah. If you don't check and everything, patient don't believe you. Okay, if you don't touch the patient, okay, touch here is not the indecent touch. The touch is examining. Okay, patient according to the necessary necessary complaints to what the complaints is, then you then then you again trust of the patient. Okay, and then you must consider the individual circumstances of all patients. Okay, all right. Some, you believe that they need maybe a more what they call broader spectrum antibiotics. Example, a patient can't afford it. Okay, so what would you do then in these circumstances? Let's say you are in the private. Okay, what do you think you can do? Any ideas? Any ideas you think you can give? Let's say a patient say they can't afford, okay, that antibiotic. Okay, what would you do? What you can do? Any opinions from you? Otherwise, you don't give opinion, we'll finish very early.
Referring the patient to any government clinic.
Okay, that's one option. Very good. Very good. Okay, refer. So other options, what you can do?
Doctor can check for Peduli Sihat, can see if they are eligible. Sebab at private also they can proceed with this one. Peduli Sihat like per visit 70
I
ringgit
have
can
to
cover.
pay sometimes.
Okay, all right, that's good idea. What about from the perspective of the healthcare practitioner? What the healthcare practitioner can do? Can the healthcare practitioner actually, in the principle of beneficence or charity, can the healthcare give antibiotic a bit discount or what they call subsidized price or cost price? Can it be done? Do you think can be done? Okay, a lot of people can put here what they say quota. What? Let me see. A lot of answers I'm getting online. Okay, yes, you are right. Okay, so one way is actually adjust the consultation fees. Okay, because your consultation fees for those in the private practice is 10 to 35. And tomorrow, Dr. Anis will mention to you an interesting fact that, you have to charge a patient 10 ringgit when they come and register. You can't charge below that because that is a medical law. It doesn't say 0 to 35. It says 10 to 35. Because if someone get to know and they know you are, attracting patient by that way, not charging consultation fee, they can complain against you. Do you know that? It's an offense not to charge patient consultation fee.
Hey, Dr. Naveen, can I ask something?
Yes, sure.
Regarding this, if we are treating colleagues, can we not charge consultation?
Consultation, that's why you need to charge. According to the Medical Act, you need to charge. Minimum
Even to
10
other
ringgit.
doctors?
Other doctors also you have to charge because
Okay, thank you.
some doctor, other clinics, I don't say that they will do that, but somebody may complain that you are not charging. Especially cases like you give MC and so on, then the employer will come after you, right? No claim, free. Okay. So even the patient comes after a few days, just don't need treatment, MC. So it's best to at least charge 10 ringgit. Okay. Because that is a requirement. Do you know that dentist can't charge less than 80 ringgit? Because that's in the Dental Act. The minimum charge for a dentist is 80 ringgit. If they do charge less, the other dentists or other clinics actually can complain against them. That's why when you go and see a dentist, you should have 80 ringgit in your wallet or in your account or something. Okay. Don't be like some touch and go users that use the highway without the minimum balance. Okay. Don't be like that. Okay. All right. So this is the law. Okay. The law is actually for good. Okay. To help the doctors, dentists to generate income. Okay. But when some doctors do this way, then it problem for the other doctors. Okay. All right. We go to the next slide. Don't know why got this writing on the thing screen. Not sure. Something happened. Okay, wait, I go to the next slide. Okay, all right. So we talk about two already, autonomy, okay, which includes the element of informed consent, okay, then beneficence, which involves the element of providing the best evidence-based treatment, okay, and explaining to patient, okay, what works best and all that, okay, considering your knowledge, skill, competency, and also the individual circumstances. Okay, I'm not sure this line came from where. Can you see the lines on my slides?
Yes, yes.
I'm not sure actually it came from where. Okay, apologize. Later on, I must clean the slides. I don't know if I did. Did I do it? If somebody else did it, okay. Okay, never mind. All right, okay. So the next is non-maleficence, okay. In Latin is pronounced as primum non nocere, okay. I mean, no nonsense, I guess. Do the good, do above all, do no harm. Okay, make sure that the procedure does not harm the patient or others in the society. Okay, first is your first duty is to the patient, second society, third other health profession, and last is yours. Okay, when intervention undertake, this is just a minor point, undertaken a physician creates a positive outcome by potentially doing harm. It's also known as a double effect. Okay, so in a palliative care patient, they're having pain, you want to give some morphine to reduce the pain, but you also may hasten the demise of the patient through suppression of the respiratory drive. That's just a minor point. Okay, so physicians are obligated not to prescribe medication that they know to be harmful. Okay. Now the question that I will ask you, the day that a few days ago I asked to my medical student, see whether you can answer or no. You are postgraduate students. My medical student couldn't really answer me. I want to see your postgraduate can know. What are the two medications? Okay, you can give me the name, either generic or whatever the real name or their original name or brand name or whatever. What are the two drugs that you can't give a child less than 18 years old and why? Anyone knows?
Benadryl.
Okay, Benadryl, if you talk those less than 12 years, okay? But what
Okay.
specifically, you correct, you are right. And Piriton also, by right, we should not, the Piriton, all this,
Exelon.
you should not give less than 2 years, lah, okay, unless they got a memang allergic reaction and so on, that can be decided later, okay. All right, so
Maxil-
someone mentioned Maxalon. Why?
Because can cause extra pyramidal effects.
Excellent. Okay, so this medication cannot be prescribed to a child less than 18 years. Okay, there is very high incidence of oculogyric crisis, which is an extra pyramidal side effect. They get dystonia, okay, and then they frighten everyone around them. Okay, so what is the treatment for this oculogyric crisis? Procyclidine, okay. Yes, it's a muscle relaxer, but you have to give parenterally, okay. It's called procyclidine, okay. This is useful in your exam, okay. Maybe may come out, okay. We don't know, okay. In your emergency or whatever, musculoskeletal, okay. All right, and then another drug, so maxilloy and metoclopramide, okay. So if patient having vomiting and so on, you got other options like promethazine, what is one, dimandrinate, so okay. All right. So another drug that you should not be given. I give you a clue. If you give this drug to a child less than 18 years, they may have Reye syndrome. Reye. Do you know what is the drug?
Aspirin, doctor.
Yes, aspirin. You are right. Okay. So the danger is having a Reye syndrome, which can cause, liver toxicity, also brain toxicity. You'll get liver edema and also brain edema, and a very high mortality rate. Okay. So today you have learned for this ethics lecture two drugs that you should not give a child under no circumstances at all. Okay. Of course, as you mentioned, the other drugs like Benadryl, Piriton, we just have to be careful. Okay. Of course, all the cancer drugs and all that, that is to be decided by the oncologists and so on, ped oncologists and so on. So metoclopramide and aspirin, remember that. Okay. As I said, do no harm. Okay. You really don't have the treatment, prescribe, ask them go and get it from the pharmacy or refer them to the another to the hospital and so on. Okay. So some interpret this value to exclude the practice of euthanasia, so doing no harm. Okay. All right. So you can't practice euthanasia. Okay, it's not allowed in Malaysia. And to me also, actually, as a doctor and what we have learned, we should not hasten the death of a patient. So if you do that, okay, when you violate the non-maleficence, then you may get a visit or a letter, subpoena or something to appear in court, okay, because you have committed negligence. Okay, and the last principle is is justice to all. So sometimes new drugs come in, okay, as we've seen during the COVID time, how the distribution should be given. Who should give first? Should you give the rich and famous, the Mahakaya, or should you give those that actually, may benefit from it, or those at the risk group? Okay, so this is the principle. So distribution of scarce health resources and the decision of who gets what treatment embraces the fairness and equality. That is justice to all. So the burden and benefit of new or experimental treatment must be distributed equally among all groups in society. So what does that mean? That means when a treatment comes out, okay, and it can, reduce, it's a good treatment, very good, newest treatment, and can, reduce the mortality, morbidity. If we look back at the COVID pandemic, it seems a long time ago, but then, something that we learn a lot, okay? So how the nation government made the My Sejahtera app and actually, decided, who gets the what vaccine first, okay? Which risk group, okay? And, especially the elderly, those with comorbidity. And also, we were quite lucky as health professionals. We also were chosen as one of the risk group, okay? And then, and we were actually given the treatment, okay? All right. Okay. So the four main areas that the healthcare professionals or provider must consider when evaluating justice. So fair distribution of scarce resources, competing needs, okay, rights and obligation, and potential conflicts with established legislation. Okay, so one of the issues we have is single pill and multiple pill, combination. Single pill is when you combine many drugs into one, okay, one single pill, like maybe two antihypertensive, two anti-diabetic, or maybe anti-hypertensive and anti what hypolipidemic or anti-cholesterolemic medication. Okay, so we are always told that if you take single pill, that will actually reduce the will improve the compliance by reducing the possible hospitalization bill, and also will improve the patient care. Okay, but always we have this conflict because it's expensive, and most of the single pill is still in the patent, still have the patent, so the prices are up. Okay, I have not seen any. I don't know. I've not seen any drug that is patented. Either they have lost their patent or currently patented. Their prices is cheaper. Have you seen any drug that has gone cheap, that have lost their patent? For those that are familiar with these drugs,
Lyrica, doctor. Much cheaper now.
what
Pregabalin.
drug?
Lyrica, pregabalin.
Okay, pregabalin. Okay, do you know the price last time and now?
I think now it's can get 250 per tablet. Last time,
Okay, previously.
one strip was, I think, close to 100 if I'm not wrong.
Okay. So maybe maybe because the demand or availability of generic. But if you can see, most of the drugs actually the prices is based on the USD, the US dollar. If it goes up, it does go up. Okay, I can name like few like Lipitor, okay, or Presto and so on. And they'll be quite locked in the market. I'm sure they have lost their patent. But of course, the distributor, the main pharmaceutical agent can say make it, but the prices have not gone down. But I guess it's a good thing that you mentioned this drug. So we can, actually, there's good, there's good pharmaceutical practice, when you lose your generic, when you lose your patent, because you have been, and your patent is not extended, then you should actually reduce the price. Okay, but we see unfortunately, it's not reduced. Okay, that's the thing. Okay, go to the next one. Okay, so we have covered the four principles. Okay, can you repeat to me the four principles? Someone can repeat to me.
Yes, doctor.
Okay.
Number one, autonomy.
Okay.
Number two, beneficence. The third one,
Okay.
non-maleficence, do no harm. And the last one is justice.
Okay, and in between you have two other uh, important domains, two other subdomains. Do you know what? Anyone else?
The double effect, is it?
What is that?
Double effect.
Okay, okay, that's part of it. But the main one I mentioned to you. One start with I, one start with C.
Confidentiality.
Okay. And two
I.
words. First word starting with I, ends with E, and no, ends with D.
Informed consent.
Yes, correct. Okay. So both are so important. Okay. All right. Maybe next time you write a paper or something, you do some qualitative research or something, you can add on. So now instead of four, we got six. Because these things are inserted, these two, into these other principles, the four main principles. Okay. So we talk a bit about what Mr. Ranjan have explained, okay, in the morning. So medical malpractice is an act or omission by a healthcare provider that deviates from the accepted standard of practice in the medical community, which causes injury to the patient. Okay. So an informed consent may still not be enough to protect the practitioner from the legal suit. Okay. So if you do something that you are not supposed to do, or you do something that you are supposed to do, but don't perform according to the standard as required, like you leave the what? I still remember the butterfly nut or butterfly clip. Okay. I still don't know what it. Okay, and then you leave the forceps, all this gauze, you can't win lah, as Mr. Ranjan said. you might as well not bother to defend lah. Just try to use up whatever insurance you have to actually pay up lah. Okay. And example will be one case where you have ingrown toenails, bilateral, and GA was used. Do you think that is that can, if anything happens to the patient during the procedure, can the next of kin actually sue the doctor? What do you think? Yes or no? Let me see what we have in the chat. Okay, a lot of people think yes. I do agree that yes, okay. So first of all, you can actually, if really patient got very bad pain tolerance, there is other method. You can do regional anesthesia or something. Just anesthetize the foot, okay. Or you can just opt to do one foot at a time. You can give local anesthesia around the toe and later on do the other foot. Okay. All right. So there is various option. Okay. So it's important to tell the patient you got various options. The option should not be you tell patient, never mind, don't worry, we give you general anesthesia, I won't feel anything, can be discharged the same day or next day. Okay. If anything happened during the general anesthesia, then the doctor in charge, the anesthetist, okay, even the hospital will be in trouble. Okay. All right, for that procedure. Of course, then later on the insurance company also Mercury, yeah. Okay. And problem for who? If the insurance company complains, why are you using GA for ingrown toenail? So it may be a problem for the patient. So patient need to pay. If the patient is under panel, is panel on the company, then the HR company will gets involved. Okay. So what problem? So just do the normal practice. Okay. When GA is required, nobody questions. When GA is not required, produce when it's done unnecessary, then a lot of issues. Okay. Right. So even involving the HR, okay, the company or whatever place that the patient is working. Okay. So any questions you have before we just go some examples and try to dig out some principles and so on.
Dr. Naveen, sorry, I have a
Yes.
question. I think you mentioned
Yes.
just two important drugs that cannot be given less than 18 was aspirin and also what was that? Maxalon, metoclopramide.
Yes.
Aspirin, but if it's in a PITS protocol, they say like it can be given for Kawasaki disease. So is it just by pediatric team who can give it, or how, doctor? How do we go
I
about
think yeah. I think this is something that we need to look at. Okay. So aspirin can reduce inflammation. Um, uh, but then there is a high incidence of race syndrome in this group. Okay. And you have to now decide, okay, even you are pediatrician, cardiologist, whether the benefit exceeds the risk.
Oh, I
If
see.
you think the benefit of that is better, that will reduce the chance of, you are worried in Kawasaki or developing aneurysm, right?
Can cause
Yeah,
any cause.
aortic aneurysm. So whether that risk is actually greater or the risk of getting the race syndrome. Okay. I guess aspirin is an anti-inflammatory drug. Okay. And you got any, if you have any suitable option, then you may consider it. But it's a good question. Sometimes we also come across it. So maybe in the case of this Kawasaki disease, it's allowed because the risk of getting aortic aneurysm may exceed the risk of developing the race syndrome. Okay, but if the patient do develop race syndrome, then a lot of questions will come up. Okay, why you not prescribe? Okay, so you have to do your calculation, decide on the balance of risk and benefit. Okay. Okay. Any other questions you have? Okay. All right. Okay. So do you have any questions?
Again, sorry, regarding the age, right? If let's say
Yes.
less than 18, any teenage is coming, and then katakan she's pregnant and also how it's always sometimes it's quite difficult to deal with this kind of
Yeah.
problems. So
So
if
if specifically what age you were thinking of?
less than 18, doctor, teenage pregnancy.
Less than 18, yeah. So
Oh.
less than 18, you have to convince the patient to let know parents. But any consent for any procedure less than 18, unless in the emergency or life saving, you have to get the consent of the parents. If you don't do that, then even the law won't protect you. Except in this case of contraception, because they got a GILIC competency, or the case of sexual intercourse that 16 years and above is allowed. Okay, but in the case of if you want a consent for medical treatment or doing anything, then you have to get the consent of the parents.
Okay, all right, doctor. So if the
Yeah.
case, in the case of contraception, if we use GILIC's competency,
Yes.
so if
Yes.
a girl is above 16,
Yes.
comes for contraception, we can keep it confidential and we can advise her and we
Yes.
offer her contraception.
Yes.
Yeah.
Yes. So in the GILIC competency, actually in our law, I think it's not, I mean, they never specifically, but you get, that competency because it's a landmark decision by, I think, the British High Court or something, okay, that can actually be used. Okay, but if you want to be really careful, you will still ask the patient to actually, if she able to, she'll inform her parents and so on. But if she don't want, then you have to use that principle. And you hope that nothing comes about. If not, then that law may help you. Because in some laws are not actually, passed to parliament. Some laws are, as you know, are made through landmark court decisions. Okay, so that is the thing I can say. Okay, but of course, like even Mr. Ranjan will say sometimes you still need the parents and so on. Sometimes that is the best. Okay, so it becomes stuck, it becomes complicated. Even though we like to say it, okay, but it's best to, of course, get the parents' consent for anything less than 18. Okay, but you have to see sometimes. It's a bit difficult. Okay. So in that case, you must actually explore, get a proper history and so on. Okay. And then decide to discuss with your consultants and so on. Okay, what is the existing guideline and how to do about it. Okay, all right.
Thank you, doctor.
As it is 16 years, we don't advise our early teenagers years, we don't advise them to get pregnant and so on. Okay, because you end up the pregnancy may have a lot of complications as well. Okay, all right. Any other questions? If not, we go to some of the practice questions that we have.
Sorry, Doctor, I just want to ask regarding consultation charge. Just now
Yes.
you said minimum 10 ringgit.
Yes.
That one is based
Yes.
on law or MMA or is it
It's
just
under Medical Act. So it's something that has been
Act?
approved
Okay.
by the Parliament way
I
back.
see.
I can't remember what law, which year
Okay.
but it's approved. So tomorrow, I think Dr. Anis, when he talks about the medical legislation, you can ask him specifically. I think it's the very famous Medical Act 1967, if I'm not mistaken,
Okay.
which they are trying to adjust to make what they call the smoking. They fail to, the generation, what they call something, or the smoking, they fail in that thing. So actually, you need to charge 10 ringgit. Okay, anyone. So please remember that. Okay, and 10 ringgit. I mean, it's okay People get paid. So how much is your glass of Starbucks? A cup of Starbucks? Anyone? Do you know what is the latest price of Starbucks coffee? Yeah. You're talking about generation end game. Okay, so we need Captain America to settle it. Okay. Captain America, or who is it? Who's left of the Avengers? Spider-Man. Okay. Settle it. Okay. Right. Okay. We just go to the question. Meanwhile, you have any queries in between? You can ask during these questions. Okay. That we get a head start on it. All right. Okay. So just tell me for each of these some of the question that we have about 11 kind of scenarios or question or situation. Let me know what ethical principle that is being followed or not followed. Okay. So the first one, using GA for left big toe abscess. So what do you think is the ethical principle being followed or not followed?
Not follow.
Okay. What is your answer?
No maleficence.
Can't hear. Non-maleficence, is it?
Yes.
Not following the non-maleficence. Okay. So what others
Non-maleficence.
think?
Non-maleficence with them.
Okay. Yeah. So you're not doing you're not practicing non-maleficence lah. So it's not primum non sera lah. Okay. So you are harming the patients. Okay. So you got options to actually give local anesthesia. Okay. And if the patient have a lot of medical problem, you may want to initially try a broader spectrum antibiotics. Okay. All right. Next one. Then the page. Okay. Next. And conducting CT TAP for patients with headache. So what is the ethical principle being followed or not followed? So what do you think? What do you think? So what ethical principle?
If this is the principal investigation to be done, then non-maleficence better.
Yeah. Okay.
I
So
think you need to
patients
do
with
other
unless
investigations to.
yeah. So I agree. So because if you see, I purposely put that TAP, okay, it doesn't include a head, huh? Or skull. So it's actually not indicated lah. Okay. All right. If patient really got very severe headache, non-remitting with treatment, after consultation with the neurologist, then you may proceed for CT scan of the head lah. Okay. When you're doing this thing, then you're not following the principle. Just to do whole body scan, I think is very unethical. I think you're harming the patient, especially if you're putting contrast. Okay. So they may get severe allergy. Okay. Anaphylaxis and all that. So remember that. Okay. And in some patients, okay, if they are not properly hydrated, may even lead to some acute kidney failure and so on. Okay, all right. So just be careful of that. Go to the next one. Okay, this is very interesting. Okay, very controversial. So when a patient comes with pain in the ear, okay, you see some part impacted wax, and if you proceed with the ear stringing, okay, so what do you think? What ethical principle you may be following or not following?
Couldn't do, right, doctor, because it can cause vagal stimulation and patient can go into syncope, vasovagal.
Okay. But what is the actual, you are right in that way. But what is the actual thing why we shouldn't do?
Wax softener.
What should be the steps involved in treating wax or ear wax?
Soften the wax. Use ear softener.
Yes, you use some ear wax softener. Okay. In the KK, I think you are using what? Sodium bicarbonate, right? Ear drops.
Yes. Sodium
Okay.
bicarbonate.
Some use the Soluvax which contain glycerin and so on. Okay. So the initial procedure you must explain to the patient. Of course, some patients want immediately to do ear stringing and so on. Okay. But maybe they have heard from other patients or their relative, that this clinic very good, doing ear stringing can cure. But maybe the circumstances of the other patient were different. Okay. Maybe, their wax already soft or something. Okay. So you always need to explain to the patient you have a hard wax. Even if we do that, ear stringing is but not benefit. As you mentioned, it may lead to, because of the increased pain, maybe syncope, or it may lead to, imbalances and so on. Okay. And, so the procedure should you should soft give some wax softener for a few days. After it's already soft, then only you proceed for ear stringing. That also must be done very carefully because ear stringing, the main complication can be tympanic membrane perforation. That may cause more problem for the patient. Just be careful. So if you practice this, that means you are practicing maleficence. You are harming the patients. Okay. Okay. Next thing. Okay. This is a very common. Prescribing antibiotics in a patient with a viral URTI. Okay. This doesn't include circumstances where you are unsure or patient wants antibiotic or something because they are traveling or something. But this include things that you know is purely viral. For some reason, you did white blood cell, you did RPC because you are suspecting having dengue or whatever. But then it turned out to be the white cell is low, your lymphocyte is predominant, granulocyte is low, platelet is maybe slightly low, and you know it's viral. So if you give antibiotic in a patient that you are very sure that don't need antibiotics, so what principle do you think you are violating or following?
Not
Okay.
following the non-maleficence,
Yes.
violating. Yeah.
Yes. So you see, when we do wrong things, we are actually a lot of time we are doing harm. Okay, we are not following that principles. Okay, when you are doing good, always is the one you are beneficent. When you are not doing good, you're always the non-beneficent. So be careful about it. Okay, because of the risk of allergy and so on lah. Okay, for the patients and so on. Okay, we saw what Mr. Ranjan mentioned. Patient allergic to sulfonamide. And he mentioned correctly telemedicine. Okay, telemedicine. The doctor unfortunately didn't check the records because maybe he was busy or some reason or another. And then patient get allergic and didn't sue the doctor for that. Actually sue when he got URTI and asthma. That's a bit very strange. And the doctor got away because when the file sheet when the file charge sheet was filed with what they call with court, put the sulfonamide cause asthma. Okay, 17 days later. So that's why the doctor got away. But be careful. Not everyone is as lucky as that doctor. Okay. It's a very odd also. The lawyer also should be, question the common sense. No, took that case. Okay. All right. Okay. Next one. Next one, prescribing pantoprazole to educated patient and gelusil to health illiterate patients. Okay, so what ethical principle that you may be following or not following?
Justice.
Justice, Doctor.
Okay, very good. Justice. Okay, so in this case, what should be done? You think what's the correct step? First of all, assess whether patient needs that medication or not. Frequently, this medication is given as to avoid gastric irritation. I see some doctors, I think now it's less, that give all this medicine very routinely. If they give Voltaren or Constant, then give Gelusil. Okay, that shouldn't be the way. If patient need, you give it. If not, just follow the usual way how we prescribe, how we mention to our patient when we prescribe this analgesic, take it after meal. If you have pain or anything, can stop and come and see. Okay, all right. So don't give routinely to prevent. Don't play defensive medicine. So because the scared patient get allergy due to this also. Okay, all right. Next one, prescribing oral antibiotic routinely in the case of acute gastroenteritis. What do you think? This is a very interesting thing. Okay, it's open up for debate. So do you think patients with acute gastroenteritis, which is usually most of the time caused by a combination of viral or bacterial infection, namely E. coli, what some more you have? Other causes, proteus or, and maybe some viral causes. Okay. It can even be from your URTI that you are getting diarrhea. Okay. And you wrongly put it as acute gastroenteritis. Huh? That mistake can happen, no? Because patient when they come in, the chief complaint, they said diarrhea. But when you check again, or you ask them, they say got fever, cough, flu. So our mind already, what we call brainwash by when patients say that they got diarrhea. So we put acute gastroenteritis. But it turned out to be a viral URTI. That because they swallow the saliva or something when they eat the food, the saliva goes into the stomach. So infected the local area, cause irritation. They said they have some diarrhea or vomit, whatever. So you decide to give oral antibiotics. So what do you think?
Non-maleficent, Doctor.
Again, yeah, you're not following the non-maleficence. You're violating it. Why I say that? Okay, because of course, you give antibiotic, you have all these minor side effects like you they have even more diarrhea. Okay, and the second thing is sometimes you can lead to this toxic condition. Do you know what it's called?
Toxic megacolon.
Yes, toxic metacolon caused by Clostridium difficile.
Difficile.
Okay, it's already there in your body, just waiting for the chance. When the time is right. So be very careful. Okay, all right. Because I've seen last time in the in some clinics and so on, private or government, similar. When got diarrhea, you know what medicine is given? Lomotil 1 TDS, Bactrim 1 BD or TDS. Okay, so Lomotil is of course can be prescribed. Okay, if the diarrhea is bad, but instead of Bactrim, we should give ORS if patient hydration is less. Okay, and then Lomotil, if you feel the diarrhea may benefit from the use of Lomotil. But Bactrim maybe it's quite it's a sulfonamide, so it's quite a risky drug to give. Okay, and then it may not give any benefit, but last patient may have allergy. I haven't seen a patient being prescribed by another doctor and came and see me because having allergy to the Bactrim prescribed for AGE. Okay, all right. So that is the thing you have to be careful. And the worst part is the patient had to be charged because this was a clinic that charges patients. Even you come for repeat medication because of some allergy and so on. Okay. All right. The next one, prescribing oral prednisolone and viral URTI. Okay, so this also is a big issue. Okay, the abuse of steroids. Okay, in viral URTI, especially used as a treatment for sore throat. Okay, so what do you think about it?
Non-maleficence not being followed, doctor.
Okay, so what are the dangers of steroids that you can foresee here?
Cushing syndrome, all the
Flare up
steroid.
the symptoms actually.
Okay, so you say Cushing. Okay, in patients that are diabetic, what is the danger if they give prednisolone?
Sugar.
Sugar will hike up.
Yes, dear.
DKA, all that.
Sugar fluctuates. Further
Okay,
cortisol suppression.
yep. If you give for of course, high doses you give, okay, but generally they give like 5 milligram, one tablet TDS, for 3 days. But if the patient develop a habit of taking it, then long term, they have problems. They may get Cushing oil, they may get osteoporosis, that may worsen their glycemic control, may worsen their blood pressure, and high dose of steroid for very long also may precipitate, may cause gastric ulcers, okay, kidney problems, or even heart failure. Okay, so that is the danger lah. Okay, so let's say a patient comes, a complaint or the patient is sore throat. Okay, and you don't have oral prednisolone. Sorry, you don't have the sore throat medicine out of stock. Let's say because of this war, what, Iran, Israel, or whatever, there is a disruption of supply of lozenges. Okay, all right. So what would you do then? What is the option? Would you say prescribe oral prednisolone, or would you do something else?
Salt water gargle, doctor.
What is that? Gargle.
Salt.
Gargle, of course.
Gargle.
Okay, let's say you don't have gargle and I make your life difficult. No gargle, no lozenges. All out or stop because urine is dry.
Lemon,
Salt water.
honey.
Okay.
Sorry.
So you can say salt water. Other options that you can do. Let's say your clinic is don't have the drug. What you can do?
The honey lemon method.
Okay.
Chamomile
Right.
tea.
What is that?
Chamomile tea.
What is that? Canon what?
Chamomile. Chamomile tea. Chamomile tea,
Oh,
doctor.
Green tea,
vitamin
doctor.
C, is it?
Chamomile.
Can you write down the thing? I tak kenal pun. I can't.
Teh bunga.
What is that? Let me see. What is the answer? Oh, okay. So this is what? Teh bunga. So is it working? So what brand you should take? Teh bunga. Is it the yours one? Or what? Is it the Christian Tamil tea? Is it? And does it work? As I know, mostly sugar. Okay. All right. Okay. So I mean, you can other options. So you can ask patient get from the pharmacy or something. And nowadays even the KK and Speedmart also selling. Okay. They're selling so deep flame all they're selling. Okay. You know that? Have you all gone to KK recently? They're selling, no? Active Fast all they're selling at the front counter. Okay. So you got the option. And then if you don't want to write a prescription, you can ask them just go KK. Okay. KK, they can buy that. Okay. Other than buying the bread or some whatever things, some kaya or something, they also can buy the tablet. Okay. All right. So they can buy it. Okay. All right. So you got other options. So get a pharmacy. Explain to them that you run out of stock and something. But these are medication you need. Maybe you don't need antibiotic for now. But it's okay. Maybe give you something else. You know, I just give you a prescription. Finish. End of story. Okay. The next one. We can't turn the page. It to text. Okay. Patient involved in an MBA comes with an abrasion wound. Okay. For some reason or another, you decide that you want to do a TNS. Okay. So what ethical principle here involved? Okay. So again,
Non-maleficence.
yes, correct. Non-maleficence again. Okay. So you find when you do wrong, you are always violating that. Okay. It's simple. Okay. When you're doing that, you're always violating that. Okay. Performing TNS abrasion work. Okay. The danger is if you perform it, then you may put, give drugs, the lignocaine and so on. That may lead to lignocaine toxicity, allergy, and so on. Okay. And that may worsen the wound and so on, especially if you don't do the pure aseptic method. Okay. All right. Simple. Okay. The next one is where some of my cases may overlap with what Mr. Ranjan said, but Mr. Ranjan had pick out the crust of the case, the best of the best. I also pick out the common of the commonest. Okay, the commonest of the common cases. Okay. So failure to note a female patient LMP before X-ray. So what do you think here? What is going on here? Okay, so some of you all say non-maleficence. Okay, I think so. I agree. Okay, so now it's compulsory lah. I mean, it has been compulsory from before also. And also, if you order X-ray form in the government setting, okay, they will ask this for the one for patient LMP. It's absolutely crucial. Okay, if you do X-ray, then as Mr. Ranjan says, what is his magical word? That phrase. What is the phrase or word used by him? If you do something that you shouldn't be do,
Negligence.
negligence, and also undefensible. Okay, so don't bother again, show the judge. The judge may even jail you. Okay, not only fine. Okay, judge may be very irritated by this gross negligence. Okay, all right. Okay, so this is very important. Okay, also important is noting the allergy history of a patient, especially they're going for procedure. See, when something happen in an emergency, there is a less chance for you to be sued as compared to when someone is going for elective procedure. Okay, like hip fractures, maybe as you say, what they call liposuction or whatever, breast and enhancement and something. You are likely to be sued for that if you don't perform according to the standard guidelines or something. Okay, as compared to and also like doing these things like X-ray, ultrasound, CT scan, and so on without proper preparation or noting the allergy and so on. Compared to emergency sometimes people think that you did the best lah, no matter what. Okay, of course you try to reduce the risk of negligence and so on. Okay, the last one is also very interesting. Okay, all right. So the last one is I try to put some positive here lah. Okay, it's not all negative and down and dusted. Okay, so agreeing with the patient who has newly diagnosed hypertension to defer treatment, okay, in lieu of more aggressive diet control and exercises. Okay, so what ethical principle do you think we may be following here?
Autonomy.
Okay, autonomy, good. Okay, so now you give the patient, okay, you can do your therapeutic lifestyle changes, your diet, exercise, stress management. But later on, when patient comes back in 3 to 6 months, still you have to reconsider whether you need treatment and so on. Okay. Generally, if patient already got stage 2 hypertension, meaning the BP is, the systolic is more than 160 to 179, or the diastolic is 100 to 109, then generally they still need medication, but it still can differ according to the patient wishes, okay, or preference. But as you also need to consider your cardiovascular risk profile. Okay, patient very high risk, already got target organ damage, already got papilloedema or heart failure, then you may want to call them earlier, okay, for review. Okay. So that is the reason why sometimes when you see in your GP clinic, patient with very high BP, okay, even stage 3, but they don't have target organ damage and so on, you may still try medication to bring it down. But once they already have the symptoms and signs of hypertension and target organ damage is either present or imminent, then you need to refer no matter what. Okay. But if they are asymptomatic, you still can give time. Okay. The main thing that the patient must be willing to take treatment. If the patient not willing, you force upon, there is a chance they may default on the treatment. Okay. And not come back. Okay. That's why if you work in the clinic and so on, it's very strange. Sometimes some patients, you wait for them, their appointment, they don't turn up, okay, for some reasons or another. Okay, all right. For other appointments, they may go, okay. Then the appointment to see the doctor is maybe one of the most defaulted of of all appointments. That someone you did some procedure, suppose come back for review or something, but they don't turn up. We don't know where they go to. Okay, maybe they may go. I did ask my staff what happened to this patient. I never come. And then she said, no lah, go other doctor. Okay. Or balik kampung or went overseas. Okay. As it is, I had one patient that actually did this breast augmentation therapy in Thailand. Some time ago. For TNS lah. And very difficult to do not a TNS. So many stitches for you. Really a nightmare. Okay. Okay. So anything you want to ask about this lecture? before I share you all the link, okay? So as time goes, I try to be more innovative lah. I know I can't be as good as Dr. Zainal. She's a real, very innovative person. Okay, I try to, fit, try to, sorry, where is my one? Okay, in the chat, I put a link there. In this link, you can actually, what they call, you can put your questions forward. Okay, so this link, per lecture, you need to fill out one form. Okay, so it's a Google form. So you can fill up. Okay, of course, when you use Google form, the first principle you have to do is you have to sign into the Google. Otherwise, you definitely the form you can't read. Okay, and the second thing you should do is, per don't ask more than two questions. The thing because I try to forward, and most of the time the speaker will give the response, but I try to like ask them maybe twice. If they don't give the response, then you don't get response, like just like you apply for a job, you don't get response in within how long you consider that successful. What is the timeline nowadays? Is it three months? Anyone recently apply a job, never get a successful, or recently apply for bank loan, never get a positive answer? What is the timeline acceptable to not getting a reply? 2 weeks. Okay, 2 weeks is good. Okay, so you don't get a reply within 2 weeks, consider a question wasn't answered. Okay, maybe I may miss the question, but as I doing this Google form, I actually can have evidence lah, that you have asked this question. I try to forward. Okay, all right. So the next thing also, I want to share my lecture. I'll put in the chat group. So if you can, you try to download. Do you want the lecture?
Yes, okay.
Okay, so I'll put the lecture. Oh, everyone. Okay. Gonna upload. Wait. Okay, so I need to just close the file first. Nanti dia tak boleh upload. Okay. I try to put the computer pergi dekat medical ethics. Okay, so I put that in the chat. For the Mr. Ranjan one, I did ask Miss Mala. She said will be in your e-learning portal. Okay. All right. If you have any problem, can let me know. Then tomorrow I can do the similar manner. Okay. And then also you got a bonus here because for tomorrow's lecture with Dr. Anis, he has already given me the slides. I'm sharing with you. You can read up earlier if you want. Okay. Okay. So yeah. So these two lectures I've uploaded. One is a medical legislation by Dr. Anis, and another one will be the medical ethics, which I just finished. Okay. All right. So now it's 3:03. Okay. So you got some time, okay, to have your afternoon tea, also snacks or whatever, okay, to recover from the stress of hearing online for more than 4 hours already. Okay. So you have the option. Do we have a questions here? So okay, okay, maybe this is the last one before you go for breaking. But they all got a long break because apa nama this Dr. Kavi's lecture is about 3:30 lah. Of course, it comes a bit earlier, like 3:25 we will start it lah. So just be around 3:25. Before that, we try to answer a question. Okay. In the case where a student is brought in by the school driver, okay, can we obtain consent over the phone or what is the correct procedure? Okay. So okay, so interesting. Okay, of course, you have to see how is the patient injury, whether you need urgent treatment. Okay, of course, getting the consent is very important. Okay, all right. But of course, informed consent written, that is the actual strongest one. If not, I think if it's emergency, if you can get even telephone confirm, verbal one. Nowadays, you can record a conversation and so on. You actually can use it, and later on you can, documents in the case notes. Okay. and later on you can document the case notes and get the thing lah. But meanwhile, you may still need a consultant's signature and so on. Okay. I think in the matter of treating patients, also we have to be careful also, okay, because otherwise we end up in trouble. And going to court and all that sometimes can be troublesome. Okay, so sometimes it can't be settled at one sitting, for many sittings. Okay, and our court is like, anyone been to a court in Malaysia? So our court, so it's there are a lot of cases to be done. Okay, and the judges are so very stressed because some cases overrun their time and so on. So if your appointment at 2 p.m., you may just be called at 4 p.m. Okay, it's not like you will be called 2 p.m. and so on. Sometimes you can get involved. Why? Because you write a medical report. Okay, and you are not the person being charged. You are the person to actually confirm the things and so on. To apparently to help the plaintiff or something that case lah. Or you can just your role maybe just to answer, but the thing is that uh, it's sometimes not on time lah. Okay. Unless you are the first few cases lah, you can overrun. Okay, it's not like in 3 p.m. case you're going 3, but that can be 4 or 5. Okay, and I pity the judges also doing their job very well, but then very stressful at times. Okay, anything else? Okay, so you said okay. However, if you do practice following these principles and so on, be very careful, maintain good communication with your patient. Generally, you should be fine. Generally, okay, but you got a backing of your insurance, okay, to help you out, but try not to do anything intentionally, okay, right? Okay, so you can take a break now, and then we'll start back once Dr. Kavi is here. Maybe you'll come back at you'll be here, but just be alert after by 3:25. Okay, thank you.